everybody on EIT Health Morning Talks meeting. We are in John Paul II Hospital in Kraków today, just after the Klaster breakfast, which finished half an hour ago. And we have this pleasure here again, like last year, to connect with you in the subject of innovative hospital. In this time, the subject of discussion on meeting is the transition of healthcare toward a sustainable model. So we will not be today discussing a lot, very little rather, about the medicine side of the cure side of the hospitals. We'll be discussing more about this side, which this part of the healthcare system, which relates more to effectiveness of managing the hospital as a place, as an organization, and especially in the area of this, as we'll learn later about this area related to logistics and supply and recycling issues and demands, and we'll learn quite a few interesting things about that. Today, next slide, please. Today we will have a few. We have in the program few things, a few speakers. My short introduction, just to set the scene. Then Michał Dybowski, Healthcare Poland Foundation, about the sandbox for green hospitals. That's very interesting presentation, and then discussion about this type of activities. Then we did have in plan transformation of John Paul II Hospital, but it may not happen because there are some technical problems to use this part. Then we will have so we can actually have those discussion with Michał Dybowski a little bit longer. Then we will have Albert King from NHS in Scotland, who will present us, and we will have this discussion, hopefully fruitful, about the reverse healthcare supply chains for circular economy. And this presentation will be related to project REHEAL, which will start in September, and to which we will invite partners, including hospitals, but not only. And finally, the key success factors for process-oriented innovations in hospitals from Department of Social Policy and Health in Kraków City. Again, here is some small problem with presence online. So I have collected some. I received some material, quite large amount of material, but I made from this material some short list of issues to be discussed, and I will present this, and then we will conclude with discussions and hopefully some kind of conclusions. And again, those who are interested in networking can come here to John Paul II Hospital to have the networking branch. So this is a program for today, which is flexible, can be modified at any time when we need this. If you want to take part in the discussion, please do so. You can just raise a hand or just interrupt and ask questions. This is something which is very, very open. This meeting is very open, and it has to serve you, not only us, to present this information. So please change this. As you see, this is a hybrid meeting. That's why we have some technical issues. We may have some technical issues. Few words about Morning Health Talks, which is the event organized annually in each year for last few years. We take part in this organized by EIT Health, and which is happening in many places in Europe. There are always subjects related to healthcare from different healthcare system transformation, AI in healthcare, value-based healthcare, data donation, cybersecurity, or hospital engagement. Those are subjects which go over and over in many places. If you are interested in these subjects, you may involve in this online or in person, depending on the place. You have to follow our website of EIT Health REHEAL program to find out where is the next and what are the subjects, in which way this is proceeded. So we warmly invite you to take part in this and choose the subject of interest. Next slide. And our approach in Kraków, in Klaster LifeScience Kraków, was from the very beginning to have this discussion about the roadmap for the hospital, for the hospital of the future. We are discussing this issue because we think this is very important to have such a roadmap, to have such a document, such a discussion and a document, which will provide some kind of guidance for innovation and innovations and innovators that are somehow involved in this healthcare system from any possible place and any possible angle. As you see today, the angle is from the backstage, if to say so. We want to have those hospitals more effective, less expensive, and to provide the care for people. Which means for us, the care we would like to deserve, we would like to have the care we deserve. I believe we deserve equally on all over the Europe, not only Europe, of course, but in first case, the issue here is that the healthcare is very different, and the level of the healthcare, the quality is very different, very different places, and also the speed of development of the technologies is very high, the exponential, and those who are at the front of this changes, those are catching up and they are developing faster. Then following that, the care in that places, in that hospitals is better. But when those people who live in the fortunate places go outside and travel or by accidentally find themselves in the other places, this care is maybe delivered totally different level, and people living outside those innovation centers also should have access to quality healthcare, which is not always the case. So having working on the hospital of the future is the ultimate objective of talking about this hospital of the future, is to prepare hospitals to adopt technologies, fast-changing technologies, to be prepared to those changes, and to foster the changes in the hospitals in order to provide better service using modern technologies, new technologies which are developing, as I mentioned, very fast. And also the discussion aims to harness all the perspectives that impact those changes, which are necessary, as we all know, in healthcare systems. And of course, the discussions also have this objective to make us better educated in that case, to feel more responsible for the opportunities we have and we sometimes miss. But we still believe that as a community we have this very important, we may be impactful for changing this healthcare system at the local, national, and international level. This is the ultimate objective of the discussions about the hospital of the future. Next slide. And we'll have several, as mentioned before, we'll have several presentations. Now we will switch to the presentation of Michał Dybowski. We invite a few guests, and one of first of these guests is Michał Dybowski, who will present us this concept of sandbox for green hospitals. This is one of the voices in this notion of innovative hospitals. So Michał, the floor is, or screen is yours.
Well, thank you very much for that. It's really a pleasure to be here with you. I'm also even more cherished by the fact it's in Jean Paul Hospital, which is a member of the Polish Hospital Federation. And we have a privilege of being to you also with the International Hospital Federation meeting over there. So now regarding your kind introduction for the role of what the Healthcare Poland has designed for the Polish Hospital Federation and for the other stakeholders within the hospital realm is actually the regulatory sandboxing used and developed by the well, it started with the concept of obviously the CSRD directive and then the reporting that's going to be required for some of the healthcare stakeholders. But what has happened over the time, we've seen that not all the technologies could get through and to be noticed by the hospital directors, because normally the hospitals are to serve the patient, to provide them with a better care, and to have a space for understanding and reasoning why to put something that is more green or less green or more energy efficient or less energy efficient or more recyclable than less recyclable, except having the, well, say gut feeling that's a good idea, how to do it. So we started to work on first what's going to be required for that legal realm. And at the end of last year, so in November 2024, we have analyzed all the elements that's going to be required for the CSRD reporting. And we issued, as a Polish Hospital Federation, a guideline for the directors of hospitals on the fact how they could measure the KPIs that's going to be required for the non-financial reporting side of the process. Obviously, that's been, in the meantime, a little bit shifted in time by the European Commission. So we don't have that urge that used to be there before. Well, but we've been anyway ahead of that. But the Healthcare Poland has provided all the insights, the analysis. We have the people on the ground who go to the hospitals. We have auditors. We have people who work with various stakeholders within the hospitals, running through the procedures, trying to see how we can improve them, optimize, reduce the cost, times, and so on and so forth. So we had a great background that is coming from the Polish Hospital Federation with over 14 years of experience of running with the hospitals. So we said like, okay, so we need to design an environment in which the technology could be put in a testing bed, validated by either the management, by the doctors, by the nurses, by the healthcare supporting staff, so administration as well, if it's related to it. And we can see how this could actually improve the patient well-being, the time of the patient's hospitalization, the recovery, the post medical treatment follow-ups, especially using the new technologies like telemedicine and everything like that. So we said like, okay, we have to design a space where that could become a facilitated thing. So knowing the fact that obviously the overall healthcares are responsible for about 5% of global CO2 emissions, coming back from the Healthcare Without Harm Foundation published reports, we figured out that there are enormous amount of the actual regulations that can support a test bed kind of facilitation, and using those EU strategies, we thought, okay, so we can actually look into the market to see how many hospitals are offering the actual test beds. So we've seen great examples from Netherlands, the Trudolf Hospital. We've seen some great examples coming from our own backyard, Poland, which is the Wolica Hospital, a tiny single profile hospital, the lungs disease hospital, where people have been trying to, and the director's been trying to work with the teams, with the doctors, with everyone else, trying to implement various scenarios, but obviously limited by the actual place itself. So we thought, okay, so there is not a whole comprehensive model that's going to incorporate all the aspects of the environment, the social parts of the processes, the digitization required for, obviously obtaining all the information and then providing the right governance on everything in there that is combining all the relevant regulations. We got the AI Act, we got the CSRD, we got the NIS2, which is the cybersecurity, and all. If we talk about gathering data, management of the data, and then conclusion built approach, so evidence-based approach to speak so, for the value-based procurement processes, then we have to have a robust model in which we can actually give the hospital managers an understanding what is the top priority, what is the biggest waste generator, and which technology actually makes sense. Obviously, having this ecosystem, we have managed to put it all together as a way. So how we said it's going to work? Well, first thing we asked the doctors, okay, what would you agree with to have innovative space for something? So they said, like, okay, if it's going to be a protected environment, something that we can just test bed in the realm without risking to expose a patient to a threat or doctor to a threat, then it makes sense, right? So we say, okay, so we understand you want a separate kind of model in which we can put that framework based on legalities, like the law on experimentation, which EIT is well known for, and NCBR and Polish realm, and how we can do the testing facility. So we started to look around the market, what's available there, and we actually got to the edX. So the edX is a great example, which is actually showing a TEF really. So testing environment facility model that could be then supplemented by the edX, and it actually gives a good joint structure around the formalities in which you can sort of use some of its elements, but obviously based on the local regulations related to putting that into real healthcare environment, and implement as a model to work on that. So second part was, okay, so we got one hospital, one set of doctors, one set of nurses, and they might be really open to something. They might say that's great, but from the perspective of the investors or having the ability to later support the value-based procurement and commercialization of all those products, we need to ask more hospitals. So here came the Polish Hospital Federation and additional hospitals who actually decided, okay, so we are happy to give you a feedback on that technology if it would be usable and implementable in our realm. So, okay, that's great, because that gives a validation for the investors to make sure that, the hospitals will be, as a system, able to benefit from that. Then we can assure it's actually deployable among all those hospitals. And then obviously we need to go and speak to the potential investors who will be financing that whole change. Because we cannot always rely only on the grants coming from EIT or Horizon and all that stuff, because it's not all covered under this. But you have to have your own sort of approach to things. And besides seeing this, we can also calculate the potential savings coming from implementation of those solutions. So okay, that brought us down to speak with BGK, the largest Polish bank, and they said they're actually more than happy to work with us on a model in which they could finance the transition. And we started to speak with the AUTMIT, which is the Agency for Technology Assessment. They are responsible for price evaluation for the National Health Services to pay for every service, that the medical service, the medical treatment procedure within the hospitals. Would they be happy to increase the valuation by the component of this greening, let's call it this way, element? So they said they might be, but we have to figure out the model. We're still working on this, but they've really been very open. And they said, like, they understand that there are some new legalities regimes coming on the hospitals to be put in place. So they understand that the valuation needs to incorporate that, rather proactive than post factum, when the hospitals will be hit by the regulations, and then they will have to sort of generate the debt that they will then try to cover up with a new funding. So we decided we're going to go forefront, and we're going to actually calculate how much this green change could cost. And we came up with some decent figures. They agreed with that, and this is sort of what they now have in their agenda. Once the time is there to have a next year implementation of the ESG reporting, then a year before that they can implement the funding for that process ahead. So this is something that was done as a prerequisite for everything. So the last but not least thing was to see how we can actually scale those solutions. So those innovations, they to be ready to be widespread and for its adoption. So we started to work with the universities teaching hospitals. And unfortunately, we don't have any of those from Krakow, but I'm hoping that that's going to change. We only been able to get 3 hospitals on board for that, but it's okay. It's a work in progress. We've just been doing that for 2 years, so I'm looking forward. That's going to increase once we see more and more technologies coming in. To actually support with the medical and science publications based on the effectiveness of certain procedures and processes, so we can have a wider adoption of those technologies in the healthcare system as a whole. Obviously, Polish Hospital Federation is a key player over that. So what we have done ourselves. So first, we decided that we're going to need a solid place, a real hospital. So we used the one that's got the least path of resistance, which is a private hospital, but a co-founding hospital of the Polish Hospital Federation. So it has been with us since the beginning of PFS. And that's actually helped us a lot because we have built a framework around their procedures. They got 2 different sides going from the operating theater up to pediatric care and dentistry as well. So we said, okay, in all those aspects, we can start, seeing what's the best thing for the healthcare, and they are facilitating us for this. So we have developed our own tools based around AI mainly. So I'm speaking to you today from the Google campus. We're working closely with those providers, but also we have our Polish companies who are developing different elements of our analysis tools. We use a system called OmniVisor, the OmniVision Med. Based on OmniVisor protocol, so it's a multi-agent system that is analyzing based on our agent design different threats and different processes within the hospital, trying to see what we can optimize in the first place. So we have the real tool to support our works and give us the actual feedbacks and suggestions. So we managed to involve all the patients and the staff. For this facility, we started to speak to the local community in Częstochowa who are using the services over there, and we had a great feedback. I mean, people wanted to see the ability to agree for the innovation. The doctor has been very open to that. The receptionists. So we literally worked with them one by one. Well, we started obviously with the group talks, but then we moved towards the individual acceptance, and we became a sort of a training the trainers, who are then became the local leaders for those processes, because obviously we cannot run everything from the outside. We have to do it within. And then we started to work with companies and the universities and those startups for the hospitals, and trying to build a model where we can actually deliver at the end. So the best criteria to support each and every technology within the value-based procurement concept, well, not concept, even model. So on top of that, because obviously there's got to be certain rules, right? We got to run it in a compliance mode, so it makes sense for everyone. So we said, okay, so we have our own accreditation center. Well, technically it's a audit and certification. The accreditation has now been removed, but it's gonna hopefully come back soon. It's been removed because the legal realm around the accreditation is limited for one accrediting body in Poland. So we have to sort of gain their re-accreditation again, so we can be a notified body for that. But it's in progress. However, we started with the first bit, which is regulatory compliance. So our Department for Law and Compliance, run by an attorney at law, who's coming back from the banking sector, by the way, and she's just, in terms of the compliance design, she knows all the bits and bobs, where should procedures go, and so on and so forth. Then we had our this auditing process, which is based around the accredited auditors who are daily auditing hospitals in various aspects. They know what's the implementation and the consequences of doing a certain process, or implementation of a certain process can have an effect on the whole scope of, down the chain elements. And then we have a lot of expert partners coming down from either market or from within the hospitals areas to advise the companies coming with those to be tested solutions to actually have a little bit more insight prior even deployment of the actual sandbox. So we know it reduces the risks and it helps a lot the technologies to actually reach the market much faster, which was the main goal. So the architecture for that is very simple. We have put in place those elements which are key areas of testing and validation. So first is obviously the infrastructure itself. Then we use some AI models and automation for that. Then we do the digital security, and our scrutiny in there is just enormous, because we know that the largest threat is through the cyber attacks. And the chains of transportation, that includes medical transportation, but also waste transportation as well. Then it's validation and certification as a whole. This is something what we invite you to. Shall you be interested in it? I'm more than happy to invite you to that. Unfortunately, as being here at the Global Campus, I just got another talk for the Ministry of Digitization of Poland, but I will come later on if there shall be any other questions. I mean, by all means, please use this opportunity to ask them to our hosts. And I thank you for your attention and have a great day. Speak to you soon. Thank you.
Thank you, Michał. Thank you, Michał. Hopefully you'll come back later on to answer some questions.
Well, yeah, so first of all, thank you very much for having me along this morning. I'm going to talk to you a little bit about something called the REHEAL project. And I'm going to talk you through a little bit of background to that, which has come from the circular economy programme here in NHS Scotland, which led to this. Also a project that we've just completed, actually. We built a minimum viable product and a solution in this space, which I think gives you a bit of evidence that this is an approach that's going to work. And then I'll talk about the REHEAL programme itself. And yeah, in terms of who I am, I'm Albert King. I am Chief Data Officer here at NHS National Services Scotland, which is the national health system for Scotland over here in the UK. So I'll start by talking about, as I say, the circular economy programme. So Scotland, as I'm sure others are, is committed to a just transition. So that's a move towards net zero that's not only environmentally sound, but also socially, economically inclusive. And at the heart of this is this idea of the circular economy. And as I'm sure you all know, that's a model that keeps products and materials in use for as long as possible to reduce waste and create new economic opportunities as well, including skilled jobs. So it's a really important and positive contribution, not just to sustainability, but as an economic opportunity. It's also an approach that strengthens supply chain resilience and helps us to manage risks from things like material shortages and, dare I say, geopolitical tensions, and as well as climate change. And indeed, as I'm sure everybody on this call will be aware, across Europe, as well as in the UK, momentum is building. And the Circular Economy Act, I think, which is expected in 2026, will tackle things like resource scarcity and waste, supported by regulations and tools that track products' life cycles, promote reuse, and so on. And so what we're doing about this in NHS Scotland is this circular economy programme. And that's partly because healthcare is a major consumer of goods and services. In fact, about 20% of the Scottish Government's entire health and social care budget goes on procurement. The products that we buy account for about 60% of NHS Scotland's carbon footprint, which is comparable to Scotland's entire waste management or international aviation sectors. So this is a really big contributor to climate change, and it is really important we tackle it. So the things that we are
during your presentation, do we know how fast this is changing? I mean, in which way this pollution is progressing caused by the healthcare system?
So I can get you some figures on that, but through our circular economy program and our sustainability program, we are annually heading towards net zero by 2030. So that's the target that we have. So one of the things that I'm responsible for is our data work stream as part of that national program. So we report regularly to boards on their progress, and they use that to make better decisions about how they're achieving their objectives. Does that answer the question?
No, that's one part of the story, but I was more asking in which what is the pace of if this is increasing the pollution we are creating actually because of the new technology, because of growth of the healthcare system, and also growth of the needs in the healthcare system.
Right, that's a great question, and so I don't have any figures on that, but it's certainly something that subjectively I see. So certainly, every year we're spending more on single-use products. So we're having to spend more time, therefore, doing things like looking after waste, thinking about how we manage waste streams and so on. So it is a huge challenge. And the other comment I would make in that space is that it's not just technology. I mean, technology and demand are a big factor, but what we found really difficult to overcome is clinicians' behavior and sort of culture and their perceptions of kind of reuse and remanufactured products not being such good quality or not so reliable. And that's something we've tackled through something called our Green Theatres program, which one of my colleagues could tell you more about if you're interested. Does that answer the question?
Yeah, okay.
So there's essentially 4 objectives that we have in our circular economy program. The first one is to achieve these net zero goals that I was talking about. The second is to quantify those opportunities and the benefits for the NHS and the wider economy. So, one of the things that we're really clear about is there's an economic play here as well through the creation of new business models, for example, which by necessity will involve the creation of new services and so on more locally. So, that creates a huge benefit for a country like Scotland that is, rural and very distributed and all these sorts of things. Also raising awareness, as I was just discussing, around and building capacity among staff and stakeholders, and raising awareness of the importance of reuse and so on, and circular economy models. And the final one is around that data innovation, technical expertise, and doing things like trying to drive more innovation into the way that we tackle these challenges. So we're also working with partners both nationally and internationally. So, for example, we have a formal partnership with Galicia in Spain. We're working on circular healthcare strategies with them. We're also a partner with the UK Design for Life programme, which is focusing on circularity in the medtech sector. And there's really strong academic collaboration as well. So over 30 million invested in research projects. And we're sponsoring PhD programs to explore alternatives to single-use devices. So, certainly in our terms, pretty substantial investments in these things. Internally, NHS Scotland has developed a set of working groups, expert groups, and government agencies, and bringing those together, along with our supply chain partners, so along with industry. As well as I said earlier, trying to influence UK and EU policy, particularly around remanufacture of medical devices, which is somewhere where we're pushing really hard for regulatory change in the UK to align with international and EU standards. So, circular economy, certainly in Scotland, really isn't a buzzword. It's a practical and really forward-thinking approach that is about transforming healthcare, creating economic opportunities, but actually creating a more resilient healthcare system as well, because given some of the challenges that we inevitably faced, I was referring to earlier, and the things that we've baked in on climate change, we are going to need to be more resilient. And so the resilience of those supply chains and understanding them is pretty important.
Albert, sorry, I have a question to last slide. You mentioned about this here about stakeholders. So who are the stakeholders in this endeavor?
So when I'm talking about stakeholders,
in your case, actually, no.
Sorry, so when you say my case, so when I'm talking about stakeholders, I'm thinking about
who are your stakeholders? Who are you collaborating with?
Yeah, so we're collaborating with clinicians, so people out in health boards who often make the decisions about products and what they're going to use. We're collaborating with people like professional organisations like the British Medical Association and these sorts of people. Also with UK government and a range of universities in Scotland. And then, of course, as I mentioned, some of the other health systems like Galicia, like indeed on the REHEAL project, like with the LifeSciences clustering in Krakow. So is that the sort of thing that you're asking about?
Partly, yes. I was interested who is really involved in locally. For example, when you solve the problems locally, who are the stakeholders with whom it's worth to have this discussion, and who should be involved in this process? Because obviously you show the you are talking about the something which is very complex in terms of the inputs and outcomes from that. You mentioned, for example, clinicians. It's not so obvious that clinicians are so much involved in the in this circular economy workflow.
So the reason we think clinicians are important is that they are often really influential in, first of all, making decisions about, for example, what products and services are being procured. And I was talking earlier about trust and the way in which clinicians think about, for example, the reliability or quality of, for example, a remanufactured device as against a newly manufactured device. So that's really important. But even in day-to-day behaviors in the workplace, so trying to influence the behaviors of clinicians, staff at every level, these sorts of people. We've also found it really important to build networks of, I don't know how it works in your context, but in our context, we have individuals within health boards, within hospitals, who are responsible for things like waste management or distribution or laundry services. And these are people who are often, in the past have been at the fringes of decision-making and influence. But so building these networks of these sorts of groups and getting their input into designing these sorts of models has been a really important part of the work that we're doing. Is that more the sort of space you were sort of thinking about?
Yeah, okay, thanks.
Yeah, okay. So as I mentioned earlier, one of our goals is promoting innovation in digital and data, in particular in circular economy. And as somebody who has a national role around data, this is something that I care about quite a lot. And one of the ways we've done that is through this something we call our CivTech challenge. So I should explain that CivTech is it's a Scottish government initiative that essentially enables public bodies like ourselves to access innovation from the private sector in a way that's very collaborative. It's very focused on problem solving. And so we had this challenge that we put out to the private sector, to industry, to see how technology can help us to increase circularity in our supply chain. And what we're trying to achieve in doing this really is that sort of more resilient and sustainable health service, right? So given the scale of our procurement, so we buy over £3.5 billion worth of products annually. We think there's a really clear opportunity to make that really positive change to all these challenges we've been discussing by increasing that circularity. And we saw a really important problem, the kernel of which is a really simple idea that we need to ask the right questions and get meaningful answers from data around the products and services that we buy, but do that in a way that doesn't compromise the confidentiality of our suppliers. And the reason we think that's important, and we think we've shown that this is the case, is that actually the data is already there. The data that we need already exists in our supply chains, with our partners, with our in our own procurement systems, these sorts of places. So the data already exists. That's not the problem. The problem is the friction involved in bringing that data together into one place in a way that we can actually use it productively to do things like model new circular economy models or what have you. And actually, it turns out our suppliers have the same challenge as us, because they actually want to, they're being expected to make a positive impact and increase circularity of their products as well. They want to identify new commercial opportunities. So actually, there's a win in this for them as well, and that's where this CivTech challenge came in. So we've built in a really quite short time, so in about 3 months, we've built a solution working with one of our major medtech vendors, which is enabling them to work with us. We've built trust with them. They are contributing their data, their detailed, things like bill of materials and all sorts of other product data into that platform. We can't see it, but it's all being integrated there in that platform. So their confidentiality and commercial confidentiality is protected. And then we're creating a way to model those products and the full impact of those products combined with our own data from our supply chain and procurement and distribution systems, so that we can see the full life cycle of those products. And that's really interesting, but it's just a start. And I suppose one thing I would point to here is that as a data person, what I'm actually really excited about is that data set that provides a foundation that actually enables us to do a whole range of other things, to model scenarios and a whole range of circular economy options. So I think it's a really, really important sort of concept we've proved here. It's not really a tech solution either. It's actually a change in how we think about sustainability, resilience, and value in health services. So I'm going to go on and talk a bit about REHEAL now, which I've been leading up to, because when we saw the call for proposals for a project to look at healthcare supply chains and data-driven transition, we were really excited, frankly, because we really saw an opportunity to collaborate with other similarly ambitious and forward-thinking healthcare systems across Europe on what is a really important challenge. And we're really delighted, very excited to be collaborating with the LifeScience cluster in Krakow, as well as 3 other health regions across Europe, so 5 in total, as well as EIT Digital. So these include Galicia, that I mentioned earlier, also Denmark's capital region, and Greece. And collectively, we represent 260, in excess of 260 hospitals, nearly 300,000 healthcare professionals, and a combined population of 17 million people. So we're very, very excited to get started on this project, which is at inception phase just now. We're going to kick it off later this year. Keep coming back for updates. We're planning a kickoff in September. And I think REHEAL really builds on some of the concepts that I've just been talking about that we tested out, I guess, during our CivTech challenge, and the ideas that came through from that, and really opens that up to even more innovators, to more healthcare systems, and to a much bigger group of supply chain partners and suppliers from across Europe. So we're really trying to address the challenge of transitioning healthcare supply chains from those linear models by focusing on essentially what we see as tackling the fragmentation of data and processes, and trying to bring all that intelligence and data into a space where we can really create value from it. So as I said, really excited to be working with you and with others on this. And I hope you have some good conversations, look forward to some questions, and looking forward to working with you.
Thank you. Do we have a question from Natalia Haraszkiewicz? Natalia, do you want to read your question? Or?
Yes. Just a moment. Good morning. So thank you for very inspiring conversations and your presentation. And I think that at the very beginning, you also mentioned that you are collaborating also with government in order to influence a little bit directions of certain regulations and policies, which could stimulate even further implementation of bio-based economy and in the context of healthcare and healthcare supply chains. So could you elaborate a little bit more which steps and which actions do you recommend to your government, and maybe any tips for the European policy and regulatory organizations in this context? Thank you.
Yeah, well, thank you so much, Natalia, and it's a really great question. So, although I work in the health service, I'm very much on the delivery end of this. Although I work in the health service, this is a piece of work that we're doing hand in hand with our colleagues in Scottish Government, so with those policymakers who are working on that regulatory context and the legislative context in Scotland, and that we take our direction from. So the experience that we are building through delivering our circular economy program is directly influencing the development of that policy. So that's one aspect of this. The other aspect of this is that alongside our Scottish Government partners, well, through them really, we are working with the UK Department for Health and Social Care and their Design for Life programme. So all of that is then also contributing to the thinking about what's happening in the regulatory space at a UK level. I'm going to be quite honest here, I'm not sure how well that works and scales into a European level, particularly given the situation that we're in. But I guess, you know, the things I would point to there are the way in which the practical experience of delivering circular economy interventions, better use and management and stewardship of resources, and building up circular economy models is directly influencing the development of policy, regulation and legislation. They're very much an integrated set of initiatives and endeavours. Does that answer the question at all?
Well, yes, of course. I mean, it's a direction which you are now explaining to us. Yeah. I was also more curious about more detailed actions, but maybe they are still not yet implemented, and you are still in a phase of rethinking and creating of certain regulatory framework.
Yeah. So, okay. So there is certainly some of that thinking going on. My colleague, Wendy Rayner, who couldn't join us today, who's my government colleague, would be able to speak to you much more authoritatively about the specific actions in that space that she's taking. So what I could do, if it would be helpful, is take that question back to her and get an answer for you. Does that sound okay?
Yeah, I think it's a very good idea. Thank you. Okay. Thank you very much.
I was hoping that we will discuss more about this, some maybe not everything, but some elements of this REHEAL project, because that's very interesting. In which way this project may be really realized in terms of to have an impact. I'll tell you why. We did have some discussions here in the region, and the first point, which was first issue which has been pointed to me regarding this plan for this project, because it will start. It's already at the moment we are in the moment of signing the contract with the European Commission. Yes, and there is some kind of plan. This is a single project, and that's the voice. This is a single project which focuses quite narrowly on some kind of problems related to logistics in the hospitals. As far as we know our realities here in Poland, if we don't, let's say, connect this project with other activities, we don't bring more stakeholders, and if we don't create some kind of the parallel activities which will support interchange with these ideas, this will something which will happen and disappear, and we'll forget about that. But we want to have the impact for longer term. So question is, for example, that's why I asked before, what kind of stakeholders we should I would say secure to be involved in the program, what kind of other activities we may want on top of the activities planned, work program planned in this project, we should be trying to involve as something which will kind of extend the stakeholders, and also extend the reach of the activities, and maybe find out some kind of cross activities, to find out synergies with other activities which are possible. So it's because the issue is complex, and if we focus, the notion is that if we focus only on these activities in the one stream planned in this project, this will not make a big change.
Yeah. So help me understand a bit. So I guess we see this project, or we're positioning this project in the context of, as I've explained, a broader circular economy initiative, which brings together sort of reform of how we do procurement, reform of how we deliver a lot of the services that support healthcare, that look at how we consume, I don't know, pharmaceuticals and these sorts of things. So I guess the sort of infrastructure that we have around this project is essentially creates a set of customers who are keen to consume the outputs of this work in order to operationalize them. So to put that another way, that essentially there's a demand there, which I'm confident that if we're successful, we'll be able to meet, and which will then enable us to scale these things up and have the impact that we determined and really want to have. And so I guess, reflecting on your question, I guess we probably need to map, as part of the project more generally, what does that infrastructure look like in each of our collaborative kind of regions, and understand how we can learn from each other on how we're achieving some of those things and creating that demand. That means that, as you point out, that it becomes more than just a project that delivers something really nice that people rub their chins and smile at, and actually has a bit of an impact and helps to save the world. So is that the sort of thing you were thinking about, that how do we actually make sure that we have the support around this that actually creates the demand, as you say, to pick this up and actually do something about it?
Yeah, partly yes. I'm thinking that there is a big difference between the healthcare system in Scotland and the way you are organized in terms of innovations, and the healthcare system in Poland, and the way the place or step, the step in terms of development we are here. I'm thinking if those differences are not too big to be, let's say, well consumed in the one project in which you are involved and we are involved, and also in the other three other regions. So how do you think those differences may be kind of utilized for good, or maybe will hinder the realization of the project?
Yeah, and so absolutely, I agree that that's something we need to understand. And so that was where I was coming from when I suggested that a good starting point might be to actually map what our environments look like. So we can gather how we see, if you like, that sort of ecosystem here in Scotland, and what it looks like in Poland. We can see how we've got those different groups, I don't know, either ready or their maturity and their readiness to consume the outputs. And we can think about how we learn from each other and catalyze some of those opportunities. So it seems to me there's a lot we can share and learn from each other about the different approaches, and then understand whether there are gaps we need to work with each other to address. I'm pretty confident that here in Scotland there's an awful lot we can learn from Poland and from Denmark and Galicia, and we're really keen to bring some of that learning into our system, as well as obviously to talk a bit about what we're doing and share how we're catalyzing some of that. So that feels like one of the early activities we need to take, is to do some of that mapping and some of that analysis of our ecosystems, I think. Does that answer the question?
Yes. One more thing. Can you give us some kind of environment in which, in your case, this project will be developed? I mean, environment in terms of the other activities. You mentioned something, but maybe some kind of examples of 2 or 3 areas which are complementary to this to this project, which are running now, or you are kind of involved in. The other activities which are helpful. I'm asking to better understand what kind of environment you have at this moment, at the same moment like we have, in which this project will be implemented. What other activities are being done right now in your ecosystem, which are related to this circular economy, circularity in hospital management?
Yeah. So in Scotland we have a national set of circular economy and sustainability programs, a portfolio of programs, of which circular economy is one, and data innovation is another. We've talked about those today, but which also include things like our facilities, our waste management, our sustainable national procurement, sustainability of national procurement, pharmaceuticals, and gases. So there's a portfolio of programs which are established, all of which are trying to tackle issues of sustainability, circularity, and which therefore complement each other. And they have a set of overarching sort of program governance and objectives across all of them. And so for example, the procurement program, the transport program, the pharmaceuticals program, all of those are looking to consume and to benefit from the outputs of the circular economy program and the initiative that we're discussing here, the REHEAL program. So that gives us, I think, an environment in which, and each of those programs is engaging both at a national level and with hospitals across Scotland, right? So each of those is doing that sort of direct engagement locally down into local health systems. So that gives us the infrastructure with which we can both understand what the demand needs to looks like, and also respond to that and provide outputs in terms of data and digital and other things that help them to meet their goals, and which then are going to get operationalized down into the way that we change services in hospitals through changes in procurement and changes in clinical practice and these sorts of things.
Okay. So probably this is a good moment to switch back to my presentation, where is please stay with us because you may have questions or you may want to comment. There is Joanna, can you my presentation? Okay. Yeah, and then next slide. Yeah. I received the materials from one of our friends in the municipality regarding those analysis and checks done just recently in this area of waste management by Naczelna Izba Kontroli in Polish, National Chamber of Control. And I quickly extracted from that those critical problems. And as we can see, there is a lot of problems which were addressed directly from that check. Inadequate supervision and responsibility. There is a whole information behind that, of course. If there is a lot of information behind those subjects, these are on the titles of the problems, but you can imagine what's going on behind that. Improper segregation of waste. I did have also the pictures which were associating this report, which was really kind of awful, too bad to show during such a presentation. Incorrect storage practices, lack of proper labeling and protection, insufficient control over external contractors, deficient record keeping, non-compliance with legal regulations, lack of staff training and awareness, inadequate waste management policies, and increased cost of and complexity during the COVID-19 pandemics. That control was actually after the COVID-19 pandemics, which such events, such accidents, they tend to uncover such mistakes, such weak places. Is from this list, if we are talking about the approach we are going to take in the project REHEAL, how many of these issues from this list this project may address directly?
So, sorry, which of these items do you think this project REHEAL would address directly?
I mean, those lists. Can you see the screen? And then 10 points.
Yeah.
So these are the problems listed in the report of national control, the chamber or something like that. I don't know the exact translating of this. These are 10 10 issues which has been directly addressed in this report. And I'm thinking if this list is somehow if through the REHEAL project we can somehow address some of this issue, or this will be hindering actually implementing the system, this procurement system we are thinking about, because of the number of issues we have identified here in the Polish hospitals.
Yeah, so
I know this is a difficult question.
Yeah, exactly. But I can still, I can still give you a view, can't I? But so I guess one thought I have is that behind each of these issues, there are probably going to be a number of factors. So take improper segregation of waste. That's probably partly to do with what people are doing day to day in hospitals, but it's also possibly partly to do with the way in which we, for example, understand what's in those waste streams and how we can recover materials from them. Equally, are there insufficient control over external contractors and deficient record keeping? So again, understanding the detail that sits behind those would help understand the extent to which, for example, REHEAL will help address them or not. Certainly, I think REHEAL helps to give much greater visibility over what external contractors, for example, are doing, because we get to see much more of the data about what's in their products, what's coming through supply chains, and so on. But what it doesn't do, and what's certainly been a problem for us, is that sometimes there's insufficient record keeping by external contractors. So we're trying through our procurement to impose more obligations on them in relation to their record keeping, for example, so that we can get more visibility. So I think you're right. It's probably quite difficult to directly address all of these. I mean, compliance with legal regulations, this will certainly help with, because there's a whole range of legal regulations either in place or coming, for example, on digital waste tracking. And I mentioned the forthcoming EU regulations on circular economy. This will definitely help with that. But I think a lot of these, we would need to do a bit more work together to kind of understand what are the drivers behind these, and to what extent will REHEAL help address them, or might they become challenges to maximizing the benefits of an initiative like REHEAL. So I think it's a bit of a mixed picture, if I'm honest.
You mentioned before about this first step, which will focus on mapping the systems. I believe this information from Nick will actually greatly help us to focus on some issues which are necessary to better prepare the project.
Yeah, I completely agree, and obviously that's something that our colleagues in University of Edinburgh are looking to mobilise and to get set up. I think in September, isn't it? They're trying to bring us together to map some of that out.
Okay, I think. Do you have questions from audience? Is it something which is interesting for you from your field of activities? I don't see any questions from here. Do we have questions from the audience? Now, you're on the next slide. In this case, we are coming close to the end. We have somehow to wrap up what we have discussed, and I was just preparing this session. I was just looking in which way we are connecting. We should connect this notion of innovative hospital with the green color of this hospital, and obviously there is, as you see, there is a lot of connections. First of all, one of the issues when I was looking also after information and what's available in that area, that was clearly the message that what Albert has also somehow addressed, the hospitals are more dangerous places in the world. That's a kind of truth we know, but also they are polluting the environment somehow. In this way, from the one side they are curing, and from the other side they are worsening our health. That's the issue, and that's why the innovative hospital should be thought or should be considered from the perspective that stop doing this. But just recently, I also found some kind of idea, the discussion which started. I'm not sure if the discussion started recently. I found it recently about generative approach for the organizations, for the companies. It was not mentioned about hospitals, but for companies. The issue, the notion is that we've been so far discussing about stopping polluting the environment, but now the thinking goes the step beyond that to have to organize, to plan, to design those activities. In our case, activities of the hospitals to be generative for the environment. So not only to stop polluting, but also to produce something good, a kind of reverse, not zero waste, but -1, -3 waste, if we can say so, on such a scales, which means very kind of revolutionary idea, especially for hospitals. But generally speaking, it's something very interesting. If we are talking about innovative hospital, it has to be green. It's not. It shouldn't be the question mark if this is possible. The question is how we do it. Give me the next slide. And in which way? The question is obviously for the hospitals. That's my kind of final thought. Obviously, for the hospitals, the primary goal is caring for patients. But when we are discussing the innovative hospital roadmap, there is several areas, and in this case, I have pointed out 5 of them, like education and training, like medical technologies, organizational culture, and hospital facility. And now we are talking about this, maybe about 6th one, about these processes which are going outside the hospital, because in a REHEAL project and maybe in many other projects, we are talking about the system which goes beyond the crosses the borders of the hospital. Yeah. Now we are talking about changing the supply supply chain by collaborating with the producer at the step of designing the goods to be recyclable. So it creates totally different approach, and that's why it's very difficult. That's why this issue requires actually the good thought and some kind of experience, and also learning during the actions. So questions we don't have an answer for. I don't have an answer at this moment. But the questions we have to ask is what must we include in the mapping exercise? Also about this mapping, which was mentioned by Albert. What do we have to learn about? What we don't know, and we still have to be learning, and what perspectives to apply? Here there are 5 perspectives. I mentioned about the 6th one, so to the supply chain, and maybe there are other perspectives where we are still not aware. So this is something we will be discussing. If you have a voice in that area, if you want to discuss, answer something or suggest something right now, please do it. If not, now please be in contact with us, and we will be doing this in the future. We'll be organizing the next meeting in the same scope, innovative hospital and innovative green hospital, in the autumn, when we start the project, or when we'll start already the project, and we'll have a lot more information and also partners to have this discussion. So I can invite you, if the subject is interesting for you, I believe it should be with us. Albert, would you like to add something to that, to those questions?
No, I think it's an excellent set of questions, and like you say, I think there's a really important opportunity here, and indeed an obligation on us all to make sure that healthcare is sustainable, and it's a big contributor to public health apart from anything else. So that looks really good. I wonder whether, as well, at your subsequent event, it might be interesting for some of my colleagues who work on green theatres to come along and listen to the conversation and possibly contribute, because I think what they're doing through a sort of surgeon-led, a clinician-led initiative might be interesting to compare notes on. But thank you very much for having me along.
Yeah, thank you. I may add yet another thing. We are starting the accelerator, the LifeScience accelerator in the autumn, and some part of this accelerator, some kind of knowledge and some kind of needs can be actually focused on this type of innovations as we are now talking about, because those are still important. The question about there is always question about the business model, because if you are talking about technologies for the medical technologies for curing people, I think we understand enough in that area in which way this can be procured and who is paying for that. In terms of logistics, involving the stakeholders which are outside the hospital at the very beginning of the value chain, it's more difficult to build the model. But I think it has to be. This can be resolved, and we may develop some kind of nice models also for those who are for those stakeholders which are on the way. Everybody has to make, let's say, business on that. Maybe some savings for some business.
Yeah. So we're trying out a few things in the project that we're doing just now, actually, funnily enough, because that is a tricky thing to square. Equally, there's also value to be created for everyone throughout that supply chain by data moving across that supply chain or it being integrated across that supply chain in a much more routine and frictionless way, because throughout the supply chain, all of those people have to be able to understand their climate impact, for example, and so they are currently spending a large amount of money trying to do that analysis and failing usually. So if we can help them to do that routinely and at lower cost, or our collaborators can, then there's an interesting little business model and opportunity in there that I think we can potentially exploit. But you're absolutely right. We need to prove all of that out and test a few ideas, and I think that's going to be part of the fun, isn't it?
Okay, thank you very much. If there are still no hands up for questions, I don't see. I think we will go to the end of this meeting. I think it was still valuable and promising for the next. Okay, I have a signal that we may now, as the final point, let you see this movie, which kind of failed before. So thank you very much for your participation in the program. Enjoy the movie, and we'll continue discussion here in the hospital. And please with us to follow us for the next meetings and the other activities, especially related to this project. Thank you, Albert, for being with us.